Hey everybody, welcome back. Again, this is Erik Brown, your Beverly Hills real estate agent, bringing you the best of LA, where we share cool local businesses and how you can connect with them. So I wanted to introduce you to a friend of mine, Dr. Elliot of Performance X Medicine, and we're going to learn all about his business.
Hey, Erik, thank you so much for passing it over to me. My name is Dr. Elliot. I'm a doctor of physical therapy, as the name implies, a certified athletic trainer, as well as an emergency medical technician. I've been in the Los Angeles, Beverly Hills area since 2020, kind of moved here during the pandemic, was serving as a clinic director for several years in a clinic here in Beverly Hills. Kind of during the pandemic, I noticed that there was a big need for mobile physical therapy. People didn't want to go into crowded clinics where they could potentially catch COVID, so they wanted people to come to them. So that's kind of how I got started with performance medicine.
Yeah. So I always love to ask, what got you started in the business?
So here in for physical therapy here in Beverly Hills, during the pandemic, like I said, there was a big need for mobile physical therapy, and things like telehealth as well became big trends during that time. So I was able to kind of jump onto that and see a need in the community and be able to help people out in a way that they previously had not been searching for services. So it should be really rewarding getting to go to people's homes, build greater connections with them as patients, see them succeed all the way to return to whatever it is that they're trying to do. So it's been super exciting, this whole journey.
It's so interesting being in a place like Hollywood or Los Angeles or Beverly Hills, where you have such an interesting segment of the market that potentially relates to the industry with Hollywood, right? So like I could be a real estate agent that works with first-time homebuyers or investors or condo lovers or beachfront properties, etc. And so it's interesting that you have, I won't call it a specialty, but a bit of a niche with people that are in stunts or in the industry. Are you finding that you touched on the idea of trends in telehealth? Are there any changes in the clientele that you see as far as what they want, injuries that they have? Are there things that you've seen as an evolution to that?
For telehealth specifically, it's a lot of people that kind of work at a desk. They tend to be younger, more tech savvy. Sure. While you're folks in either in the digital art world, or they're drawing with a stylus on a tablet all day, or they're working in tech, programming on a computer. That tends to be the population that's kind of more interested in this telehealth idea, the whole work from home model. Just this whole work from home paradigm has changed a lot of the ways that we think about healthcare, and a lot of healthcare companies that aren't adopting to that model are really going to kind of get left in the dust. So we're just trying to be as flexible as possible and shift our practice to kind of meet these people where they're at.
That's great. And for those viewers that are watching, particularly the ones that have an interest in this, tell me a bit about what the process is like. So someone decides, I have a need, whatever it is, arm, leg, etc. And they say, I absolutely could use Dr. Elliot's help. What is that like? They call, they email, and then what happens?
Yeah, so no matter whether you're somebody that's just coming out of a joint replacement surgery, or you're someone that's struggling with some kind of a repetitive stress injury from work, my website, Performance X Medicine, has my treatment application on it. You can go to the site there. All of the information that's pertinent is listed on the website. You go in, fill out the treatment application, and then they'll send me an email, and I'll get in touch with you directly, and then we can discuss what your plan of care is going to look like, where we want to meet. I have a little bit of office space available if that is something someone is interested in, but mostly I'm a mobile practice, so I'm going to people's homes. So I operate primarily within the Beverly Hills, West Hollywood, Bel Air, kind of adjacent areas here, but that can be flexible if needed.
And my guess is you, based on your expertise, you help people kind of diagnose what a treatment plan might look like.
Yes. Yeah, that is definitely a huge part of the evaluation process. I want you to understand what's going on with your body so you can make the most informed decisions, and it helps you get back faster. There's a lot of studies that show that a lot of pain is associated with kind of the fear of the unknown or not understanding what's going on. And pain education is actually one of the biggest things that we can do as physical therapists in order for people to understand why they're dealing with what they're dealing with and how they go about resolving it. So after you're done with me, you should understand exactly what tissues are involved, what the plan of care is going to look like, what our treatments are going to be looking like, what you have to be doing at home on your own in order to get better. Like, I'm here to help facilitate your growth, but I'm not going to do all the work for you. Like, only you can be doing the exercises on a weekly basis, and that's truly where the progress is going to come from. I'm opening up a window of opportunity for you to be able to kind of help yourself.
Yeah. Well, I always love to ask as a big question, and of course, we're going to pop up all of Dr. Elliot's contact information here on stream. So at any point, if you have questions, would like to have a conversation, if you or someone that you know has a need or is looking at a plan, please do connect here, as we had mentioned with all the info that we have on screen. But I always love to end by asking, is there anything else that you think that the viewers should know that you think would be helpful about your business or about physical therapy or about any of the work that you do?
Yeah, I'm a true believer in physical therapy first. I believe there's a lot of issues that kind of get misdiagnosed, mistreated in traditional kind of medical models. A lot of times I'll have patients that come to me after having gone to their doctor for an injury that they sustained at work through overuse or something like that. And the doctor told them to rest, ice, brace. They got multiple cortisone injections. And by the time that they've gone through this whole process and realized that a lot of these things were just kind of band-aid fixes, the injury has progressed and nothing really changed. So a lot of times physical therapy as kind of a first course of action, I'm not saying not to go to your doctor, but definitely advocating for yourself for physical therapy can make a huge difference in, I'd say, about 90% of the injuries that we see. Obviously, if there's something that you broke a bone or need surgery for, that's a totally different situation. But for most things, physical therapy could be a really great solution that can kind of nip things in the bud and get you back to 100% and truly treat the underlying root issue.
I love that. Well, thank you so much for coming today.
Was able to hear. Thank you so much.
The pleasure is mine. As always, guys, I am Erik Brown, bringing you the best of Los Angeles. We share cool businesses like Dr. Elliot's, and so I would love for you to stay tuned for the next video that we have in the series. Until then, this is Dr. Elliot and Erik Brown signing off.
Take care.